Okay. So this is probably going to start to garner some questions from the gallery. You'll probably see the following common baby problems when people book their baby with you. So they're all kind of tied neck and neck here. So a head turning preference or gaze preference, like torticollis, but honestly, I consider torticollis, a true torticollis, an actual lack of growth in the associated muscles that keep the head up and rotated and side bent. But as we know in osteopathy, that can look different and come from different places. It's neither here nor there. Oftentimes, people will bring their baby in and say, yeah, my baby's rotated and, like turns their head that one way, and the body is often side bent the other way. So if the head's rotated right, the body is side bent left, and vice versa. It's a common presenting pattern in babies. Another thing that you'll commonly see are the head shape problems. So they'll come from two sources, the intrauterine, so they're born with it. It's a positional thing in the uterus, depends what structures they were up against. With twins, almost all the time, one of the twins will have plagiocephaly or a head shape problem. And those are the most stubborn to treat, often requiring a band or a helmet. They're 3D printed now. They're not as fat and thick as they used to be. Eventually, this comes into the baby's life. Some parents opt not to do it. I encourage the family with whatever they want to do, but whether or not they get a band or a helmet or not, I encourage monthly treatment for sure, because you have to keep activating, the neck and making it loosen up and move, and getting into the upper cervical joints and balancing the dura that goes all the way down the neural tube from the head down to the sacrum. Very, very common. You're going to see them, latching difficulties and fussiness. So there's many sources for that. And that would probably be, honestly, I think the hardest thing to catch what the actual problem is. It's worth it to take the time to take that apart, because you'll find the source of the problem much, much easier. So it can be compressed OA. It can be a shoulder issue with some torticollis. It can be quite the deep side bend that's pulling the whole body down. It can be partly tongue tie, partly birth injury. It can be all tongue tie. And there's ways to figure out and palpate what part is your job and what part needs to be addressed by a release provider. That can be taught. I figured it out. I took the time to figure it out and put it into a nice course if anyone is interested. And then that last thing, you're going to obviously hear about colic, spitting up, reflux. And there are many reasons for that, from swallowing too much air because of poor latch and the air pushes up the spit up, or makes baby, unhappy because they're spitting up and choking, or unhappy because they've swallowed air and it has to then move all the way down and they have to express it out the other end. Or there can be different things that influence the gut lining. If mom was on antibiotics or baby was during the birth, or certain medications can change the microbiome for baby. It gets a little bit convoluted. That's certainly a topic for another time and for a different course. Potentially in the future, I'm trying to get somebody to work with me and come teach us that. So that's a little surprise coming for you. She's from Britain, wonderful lady. So those would be the top four. Now there's lots of other things that can come into your office and require your attention, but yeah, you'll see mostly those. Does anybody want to talk about one of those? Does anybody want to talk about treatment timing? Does anybody have a case study that they want to talk about? Mallory, do you have a question?